From the National Press Club in Washington, D.C., this is a special report to Rewind. Shortly after the Supreme Court announced its decision to uphold the Affordable Care Act, a newsmaker panel gathered to discuss the court's ruling. The healthcare experts sought to answer questions on the impact of the court's decision. First, their initial reactions to the ruling.
Yesterday when the decision came out, as Jenny has just described, many of us took a big sigh of relief because we've been operating in relative confusion, lack of clarity, and not knowing exactly what the next step was going to be. From my perspective, the bill as it was passed had a lot of wonderful benefits to people who wanted their insurance companies to do something different, but it really didn't speak directly and aggressively to the point of transforming healthcare delivery so that the total cost of care came down.
Consumers' views of the Affordable Care Act haven't changed much since fall of 2009. And people fixed in almost on two polar views of the reform. If you believed that the government was trying to take over the healthcare system, then you moved as an opponent. On the other side, if you believed that the healthcare industry, kind of gestalt view, is prone to self-dealing, that it's prone to greed, that it's prone to two systems, as John Edwards said, haves and have-nots, then you tended to believe the law did more good than bad.
The panelists also expressed their concerns regarding the policy changes and laid out the challenges faced by both the healthcare industry and the government.
We are concerned that the future aspects of the law that are yet to be implemented will impact the affordability, that premiums will be driven up instead of down. Here's some examples. 2014, a premium tax will be imposed on health plans and health insurance companies. Now, I, as one who runs such a plan, don't like a tax, but we will pay it, and the only way we can pay it, however, is to pass it on to our customers. A second element that will cause probably an increase in premiums is once the federal agency, yet to be determined, or the state agencies, yet to be determined, who are going to determine what the essential benefit package is going to be, it could very well be that the essential benefit package will have items in it to be covered that currently are not covered, and people will be required then to purchase something that they really may not feel is necessary for themselves as an individual. But the age rating banding that is currently in place, especially in states like Virginia, there are other states where the bands are already very tight, but in Virginia, we virtually have no regulations, and so it's not uncommon for me to put a price out for one individual or small company that is X, and another one might receive X times 8. January 1st of 2014, that range has to squish down to X times 3. Now there's going to be winners and losers. The older folks, the sicker folks that have already been referred to here, thanks for not including me in that class, will be very happy. Our rates will come down. But the younger individual who's relatively healthy, they're going to end up paying more than they would have otherwise.
And one of our biggest concerns now that we have some finality in terms of where we're going is that the federal government has frozen their support for their share of the cost of training physicians since 1997, back when we thought we were going to have a big surplus and didn't realize the baby boomers were going to live this long. So we now see the per capita numbers of physicians declining in this country, just as 10,000 people a day turn 65 and go on Medicare for the next 19 years. So that's a lot of people with a lot of high need for the healthcare system. And then you add to that 30 million, give or take, more people who are going to come in and have access to insurance in another 2 years, theoretically.
I think the other dynamic here, obviously, for the Inside the Beltway speak is the fiscal cliff and the physician fee schedule problem, which afflicts Tools members and everybody else here around the table. Congress addressing that either in the lame duck session or in the first 2 quarters of the new calendar year could could it create an environment, depending on if there are strong Republican majorities in the Senate, where certain provisions related to the law, but not the whole law itself, are either delayed or put off or scaled back? So I'm thinking about subsidies that the IRS is offering to individuals to buy health insurance on exchanges. Could those be delayed a year or two or reduced in some value to help pay for whatever grand bargain is necessary to bring deficit reduction, tax cuts, SGR reform all into the fold?
But it is going to be a challenge. I don't think, this nation is not going to agree to any kind of rationing of care. I think there's always an element of personal choice. It's going to have to be a partnership with patients, as Mike had suggested, but we're going to have to take some action pretty soon.
This is a very messy discussion. I think the common thread here is that old models in this system are not just pervasive, they're defended to the hilt. We defend that our demand is based on yesterday's numbers, and we don't think that perhaps we have to just turn this thing upside down. What are the new models? How do we break the cycle of rear view mirror solutions in healthcare? And I think that's our fundamental issue. There's plenty of money in the system. We don't use it in the right places, and we don't break these bonds of gilded, almost archaic ways of doing what we do. You look at where investors are making bets about the future of the system. They're making bets on these disruptive innovations and these new ways of doing things because they don't think any of us can solve the problems based on our old models, period.
As healthcare providers, insurers, businesses, we can start embracing the fact that real healthcare happens at a community level and integrate even beyond the medical professionals to lay leaders. In the Hispanic community, we use promotoras that are trained lay leaders that go and talk to their friends at church, talk to their friends at the store about how to manage their diabetes. Those are the kinds of elements of transformation that are key as we move away from understanding that healthcare does not happen in the doctor's office, it happens in the community.
That's again part of this transition from rearview mirror, where we associate quality with the parking is adequate, the food machines work, when I push the call button somebody shows up, the doctor treats me with dignity and respect, knows my name, to accuracy of diagnosis, appropriateness of intervention, and I know as much about my treatment option through my real-time mobile platform device as the doctor that's sitting there struggling to figure out what to do. That world is before us. That changes the whole trajectory of that whole Affordable Care Act discussion.
The panel recognized the challenges faced by the Republican opponents. From their perspective, the prognosis for repealing the health care law is not optimistic.
The Friday after the general election, November 16th, is a very critical date to the state exchange process. It's the date by which all of the states have to file with CMS. They have to file with CMS essentially their blueprint. They have to show material progress going into 2013. One of the interesting things that I find in that timeline is the fact that it's right after the election. You know, the Republicans out there are certainly pointing at the election as probably being the next material validation point, if you will. I'm not sure, whether you believe Obama's going to be elected or Romney's going to be elected or Obama reelected, that, a President Romney could actually do anything in the few days after the election before the Friday.
In the event that Republicans maintain or are able to obtain control of the chamber, that they will move to repeal the bill by reconciliation, which is a 51-vote target. Even that, I think, will be hard. Even if Republicans make gains in the Senate, they're not going to be monumental gains that give them the comfort zone to be able to easily get 51 votes to repeal provisions that we've all been talking about here this afternoon that are inherently popular, even though the law itself maybe polls badly. When it comes to people's individual benefits that the president talked about in his speech yesterday, those are hard to take away. I think that chances of repeal by reconciliation by this time next year are lower than 10%, but it will be tried.
If you don't get it done in a year, once 2014 hits, assuming that we're on schedule with a lot of this, it becomes very difficult to then take stuff away from people.
From Washington, D.C., this is a special report of Rewind.
Insurance companies to do something different, but it really didn't speak directly and aggressively to the point of transforming healthcare delivery so that the total cost of care came down.
Consumers' views of the Affordable Care
Relative confusion, lack of clarity, and not knowing exactly what the next step was going to be. From my perspective, the bill as it was passed had a lot of wonderful benefits to people who wanted their...
It sought to answer questions on the impact of the court's decision. First, their initial reactions to the ruling.
Yesterday when the decision came out, as Jenny has just described, many of us took a big sigh of relief because we've been operating in...
From the National Press Club in Washington, D.C., this is a special report to Rewind. Shortly after the Supreme Court announced its decision to uphold the Affordable Care Act, a newsmaker panel gathered to discuss the court's ruling. The healthcare expert
Act haven't changed much since fall of 2009. And people fixed in almost on two polar views of the reform. If you believed